Hi, how are you going? I hope you're feeling as well as possible on your medicines. I'm Pharmacist Fi. Welcome to my YouTube channel and to episode 6 of our series called Medicine Safety, 7 Things You Can Do. Number 6 of the 7 things you can do is to find out how medicine problems happen to try to avoid them. Key areas where I have seen people having medicine problems include medicine side effects, medicine interactions, mistakes in how to take or where to keep medicines, accidentally collecting someone else's medicines from the pharmacy, mistakes by health professionals or carers, and differences between people in how our bodies are affected by medicines. Now we know about 6 medicine problem areas. Let's jump down into each of these 6 rabbit holes to find out how medicine problems are happening and how we can try to avoid them. Medicine side effects. With quite a few types of medicines, you may not know if you're going to get side effects or not until you take them. But 3 things that increase your risk of medicine problems from side effects are, number 1, not knowing about possible side effects for each of your medicines. Number 2, not knowing what to do about side effects if they happen. And number 3, not knowing that some medicine side effects are completely different to the main effect of the medicine. So if people don't know these things, they might incorrectly think that a side effect is a new medical condition, or they may not do anything about the side effect because they don't know if it might potentially be serious or not. So the side effect might get worse and the person might end up in hospital or even die from a medicine problem that might have been preventable. So my 4 top take-home tips for trying to minimise medicine problems from side effects are: number 1, get a CMI for each of your medicines and read the section about side effects and what to do about them. Like whether you need to get to the nearest hospital emergency department immediately, or if it can wait until your next doctor's appointment. Number 2, keep your CMIs near where you keep your medicines, so they'll be easy to find if you're ever in an emergency. Number 3, for each of your medicines, ask your pharmacist to help you write on your medicines, allergies and contacts list the most common side effects, any dangerous side effects to watch out for, and what to do about them if they happen. Number 4, if you think you may have a medicine side effect, follow your CMI instructions and your pharmacist instructions on what to do about it. And if it might potentially be a dangerous side effect, act quickly and take it seriously, because it is so much better to be safe than sorry. And I will put links to videos about CMIs, side effects, and making a medicines, allergies and contacts list into the description section below this video for you. Medicine interactions. There are a lot of different ways medicine interactions can happen. And something a lot of people don't know is that some prescription medicines from the doctor don't just interact with some other prescription medicines. They may also interact with some non-prescription medicines from the supermarket or pharmacy, or with some vitamins or minerals, or herbal medicines, or herbal teas, or supplements, or some foods or drinks, for example grapefruit, and even some non-medical drugs like products with alcohol or caffeine in them, or smoking. So what can you do to try to avoid medicine problems from interactions? My number 1 top take-home tip for this section is to ask your pharmacist to run an interactions check for you on their computer for everything you take, including all the categories I just mentioned. And if that brings up any significant interactions, ask your pharmacist to help you contact your doctor as soon as possible to figure out if any medicine changes may be needed or not. If medicine changes are needed, ask the doctor exactly how the changes should be made. For example, if a medicine needs to be stopped, should it be stopped immediately or gradually? And if gradually, how? I will put a link to a video about medicine interactions into the description section below this video for you. Mistakes in how to take or where to keep medicines. A lot of mistakes in how we take medicines can be avoided by these 4 top tips. Number 1, make a medicines, allergies and contacts list with your doctor and pharmacist. And number 2, ask your pharmacist to print or email you a CMI for each of your medicines. Then, number 3, check if the CMI instructions on how to take your medicine match with your medicines, allergies and contacts list and your medicine label and container. And if any of these things don't match, ask your pharmacist to check it straight away. Number 4, check the CMI section about where to keep your medicine to find out what temperature range your medicine needs to be stored in, which includes both what maximum and minimum temperature. And also check whether it especially needs to be kept away from contact with sunlight, moisture or air. And follow these CMI instructions to try to prevent chemical changes in your medicine which might cause medicine problems. Although these 4 top tips can prevent a lot of medicine problems, there are some other important ways medicines could be taken the wrong way, like because the instructions did not tell you enough about how to take it, or thinking medicine instructions have a different meaning from what the doctor or pharmacist thinks they mean, because some instructions can be interpreted different ways by different people. My number 1 top tip on how to try to find out exactly what the pharmacist or doctor means when they give you instructions on how to take a medicine is by saying to the doctor or pharmacist what you think the medicine instructions might mean and asking the doctor or pharmacist if that is what they are thinking. And if it is not what they're thinking, immediately write down onto your medicines, allergies and contacts list the more detailed explanation of medicine instructions which they should then give you, and get them to check it. Or, if you don't read, ask the doctor or pharmacist if they would mind if you can record them saying instructions for how to take each medicine onto a recording device, such as your mobile phone. So then you can play that back to listen to those instructions regularly before you take your medicines. Here are 2 common examples of different interpretations of medicine instructions that I have seen, and some top tips to try to prevent them. A lot of people think take 1 tablet twice daily might mean that they could just take 2 tablets once a day if they like. But for most medicines, if your doctor or pharmacist writes take 1 tablet twice daily, they're advising you to take 1 tablet every 12 hours because the medicine only works well for about 12 hours. But there are a few exceptions to this rule, where a doctor writing take 1 tablet twice a day might actually mean a shorter amount of time than 12 hours. For example, 6 hours apart, or 1 hour apart, or 2 hours apart. But when they write take 1 twice daily, it still does not mean take 2 once a day. My top tip for this section is that if a doctor or pharmacist advises you to take a medicine more than once per day, ask them exactly how many hours apart the doses need to be taken. Another big mismatch in thinking between health professionals and patients is that when a doctor advises you to take 1 tablet daily, they actually mean try to take 1 tablet at about the same time once every 24 hours. Whereas a lot of people think it will be okay to take 1 tablet any time of day or night. But for quite a lot of medicines, taking the medicine at different times on different days might reduce how well the medicine works, which could be bad for the medical condition being treated. Or it might increase side effects, which are not fun. An interesting thing a lot of people don't know is that some medicines work better or have less side effect risk if they are taken at a particular time of day or night. My top tip for this section is that if a doctor advises you to take 1 dose of a medicine per day, ask them if there's a particular time of day or night that is best to take that medicine. And get them to help you write that onto your medicines, allergies and contacts list, so you can regularly check how to take the medicine to try to take it the best way possible. Another cause of medicine problems that I've seen is when people forget how the doctor advised them to take a medicine and just guess how to take it. This situation might happen because the doctor only put take as directed by your doctor on the medicine instructions label, or because the person threw away the container of the medicine which has the medicine instructions label on it, or because the person doesn't read the medicine container, either because they don't like reading or they actually cannot read. So my top tip for this section is that one of the most important things everyone should know for medicine safety is that the doctor will not be annoyed and will actually be happy to repeat medicine instructions for you, because they are there to help you get as well as possible. And the thing they want least of all is for you to take your medicine the wrong way and have medicine problems. So never feel uncomfortable about asking your doctor or pharmacist anything about your medicines. That's what they're there for. Common causes of medicine problems, which we cover in a different video, are forgetting medicine doses or accidentally taking too much of a medicine. So please follow the link that I'll put into the description below this video to watch video 4 of this series, which has a stack of top tips to help avoid these medicine problems. Taking a medicine after its expiry date is another possible cause of medicine problems, because chemical changes might happen in medicines after their expiry date. So my top tip to avoid this problem is to keep each medicine container while you are still taking that medicine. Even if you put the medicine into something else like a dose aid, a dosette box, or a tablet organiser, keep the container while you're still taking it so that you can check expiry dates on your medicines regularly and never take a medicine after it has expired. Another way medicine problems can happen is if people knowingly take medicines in ways that are different to the medicine instructions. For instance, if they take more or less of the medicine than the instructions said to take, or if they take the medicine more often or less often than the instructions said to take it. These things might increase side effects or decrease the good effects of a medicine. So if you suspect that you might need a change of dose or to take a medicine more or less often, my top tip for this section is to ask your doctor about this as soon as possible, and only take a medicine in a way that is different from the original medicine instructions if a doctor has agreed to that change. Accidentally collecting someone else's medicines at the pharmacy, if people are in a rush to collect their medicines or are feeling tired or sick or in pain, these things can make it much harder to listen. So the person may end up accidentally saying yes to a name called out that is similar to their own name, or sometimes even a completely different name if they think that they should be next because, for example, they're the only person standing waiting in the pharmacy and the pharmacist or pharmacy staff member who calls out the name smiles at them. But keep in mind that the name called out could be for someone who's left their prescription at the pharmacy and gone shopping elsewhere. And the pharmacist or staff member might be smiling at you to be friendly and acknowledge you, not necessarily because they know your name, especially if they are a locum pharmacist who is not always working at that pharmacy, which is often the case in rural pharmacies. Another way that someone else's medicines might accidentally be given to you is that if all the customer medicine trays are stacked close together on a pharmacy shelf and someone has multiple layers of medicines in their tray, if that gets bumped, medicines might accidentally fall sideways into someone else's tray. So if this ever happened, you might get one or more of someone else's medicines as well as your own. And this has happened to my mum. So although it is rare, unfortunately, it may occasionally happen. My top tip to avoid both of these ways of accidentally getting someone else's medicines is to always check the label of every medicine you collect before you leave the pharmacy to make sure they all have your name on them and not someone else's. Mistakes by health professionals or carers might involve errors in what medicines we are given by the doctor or pharmacist, or what instructions we are given about how to take medicines and where to keep them by the doctor, pharmacist or nurse. Or if we are ever unable to take medicines by ourselves, a carer or nurse helping us take medicines might accidentally give us the wrong medicine or give a medicine to us in the wrong way, like accidentally giving a suppository by mouth, or accidentally crushing a slow-release tablet that needs to be swallowed whole. While not all mistakes by health professionals or carers can be avoided, there are some good ways you can try to prevent mistakes. So my top tips for this section are: anytime you get a new medicine that you have never taken before, ask the pharmacist what it is for. And if the medical condition they say does not match what your doctor wrote on your medicines, allergies and contacts list, get the pharmacist to check it. This one quick question and check might pick up an error by either your doctor or pharmacist. So this is a brilliant way to try to prevent medicine problems. Never feel uncomfortable about asking a health professional about any possible medicine error. Your pharmacist or doctor or nurse will not be offended by you questioning whether everything is correct, because your safety is their absolute first priority. Anytime that a nurse is about to give you a medication, ask them to please read you the name of the patient on the medicine chart or the medicine container, plus what route the medicine should be given. For example, whether the medicine is to be taken swallowed by mouth, or put onto the skin, or into an eye or your nose or your ear, or inserted into the rectum or vagina, or given as an injection into a vein, which is called IV or intravenous, or given as an injection under the skin, which is called SC or subcut or subcutaneous, or given as an injection into muscle, which is called IM or intramuscular. These two questions about patient name and medicine route could prevent you from accidentally getting someone else's medicine or accidentally getting a medicine given to you the wrong way, which are some of the key ways that medicine problems can happen in a hospital or an aged care facility or home care. If you have a carer who helps you take your medicines, ask them to please read the How to Take This Medicine section in each CMI for each of your medicines, and to check if these instructions in the CMIs match your medicines, allergies and contacts list and your medicine labels and containers. And if anything seems different, ask them to please contact your pharmacist or doctor as soon as possible for advice on exactly how to take those medicines. If you have a carer who helps you take your medicines, ask them to regularly read your medicines, allergies and contacts list just before they give you your medicines, to try to make sure you get the right dose of the right medicine taken the right way at the right time every time. Differences between people in how our bodies are affected by medicines may be due to genetics or age, especially if people are over 65 or less than 12 years of age, or pregnancy or health conditions, for example, liver, kidney or heart problems. And any of these things might make some medicines either have more effect or less effect than they would for most adults, which could cause medicine problems. My top tips for this section are: ask a doctor or pharmacist if you will be able to tell whether the medicine is working or not. And if you will be able to know, how will you know? What effects should you see or feel? And how long should the medicine take to work well? This is important because if you get less effect or no effect by the time most people should have a good effect from a medicine, then you can tell the doctor as soon as possible so that they can advise you whether you may need medicine changes. For example, a different dose or a different medicine. If you get more effect than most people from a medicine, then you might also get worse side effects. So it is especially important that you follow the earlier tips in this video to find out about medicine side effects and what to do if they happen, and to get an interactions check by your pharmacist, as well as following the other tips that we've chatted about to try to avoid medicine problems generally. If you're female and there is any chance that you might currently be pregnant or that you may get pregnant, tell your doctor and any other health professionals like your pharmacist, dentist or nurse before they give you any medicines, because a lot of medicines should be avoided during pregnancy. Plus, women who are not currently pregnant should also be aware that for some medicines, they should avoid getting pregnant both during treatment and for some time after finishing treatment. For example, women should avoid getting pregnant during treatment and for at least 3 years after taking acitretin because it has a high rate of birth defects. A lot of people don't know that women's metabolism changes during pregnancy, so some medicines may need their dose adjusted at different stages of pregnancy and also after the woman has given birth. So ask your doctor whether or not this may apply to you and any of your medicines. I think a lot of people would know that some medicines should not be taken during breastfeeding, but what they may not know is that the medicines which should not be taken during breastfeeding are not always the same ones as during pregnancy. So, if you are planning on breastfeeding, make sure you check any medicines with your doctor or pharmacist, including medicines from the supermarket or pharmacy or herbal medicines, as well as prescription medicines from your doctor, to see if they may be safe for your baby or not. Men who are wanting to father a child should also be aware that there are some medicines they should avoid too. For example, men who take the antifungal medicine griseofulvin, which has brand names like Grisovan, are advised by the manufacturer not to father a child for 6 months after stopping griseofulvin, as well as during griseofulvin treatment, because it may affect their sperm. So if you are wanting to conceive a child, check your medicines with your doctor or pharmacist first. I will put links into the description section below this video for you to websites with fact sheets about risks of medications during conception, pregnancy and breastfeeding. Please click the subscribe and like buttons below this video if you would like to see more of these medicine safety videos. And Denver and I look forward to catching up with you again very soon here on this Pharmacist Fi Medicine Safety YouTube channel. Thanks for watching. Bye.